Canada does have one of the highest incidences and prevalences of inflammatory bowel disease in the world. It's been estimated that by 2030, 1% of Canadians will carry a diagnosis of either Crohn's disease or ulcerative colitis. Yet, despite this, I do think that there's a general lack of awareness.
Crohn's disease and ulcerative colitis are two similar but distinct lifelong bowel conditions. Crohn's disease and ulcerative colitis can take a huge toll on your life. The good news is that both conditions can be managed along the treatment journey as they advance.
Ulcerative colitis and Crohn's disease are the two main variants of inflammatory bowel disease, which is an overall term for those two. They're very similar, but a little different. Crohn's disease can affect any portion of the gastrointestinal tract from the mouth to the bottom. We call it a gum-to-bum disorder, and can have some particular complications because it can affect the whole thickness of the wall of the bowel. Ulcerative colitis is a chronic condition. There really is no cure for ulcerative colitis, so once diagnosed, people live with it for the rest of their lives. It's an inflammatory condition that affects the lining of the bowel.
Crohn's and colitis have a significant impact on quality of life. We have to remember that these conditions, both Crohn's disease and ulcerative colitis, affect people at any age.
The peak age of onset is in the 20s, although it can span the spectrum from infancy to old age. But the most common age of onset is in the 20s and can really disrupt people's education, people's forming of relationships and friendships, and starting careers.
For patients experiencing symptoms of Crohn's and colitis, meal times can be painful, both physically and emotionally.
Meals are often a trigger for patients, both in terms of physical symptoms, but also in terms of some of the psychological distress that our patients experience. Trying to find things that are comfortable, trying to find things that they can tolerate, and eating is often a social experience which can be disruptive by this disease.
Dr. Marshall stresses the importance of discussing your symptoms with a healthcare professional. Crohn's and colitis are treatable once properly diagnosed. Signs and symptoms that are common to both Crohn's disease and ulcerative colitis include diarrhea, fatigue, abdominal pain and cramping, blood in your stool, reduced appetite, and unintended weight loss.
I think it is important that patients discuss their symptoms with physicians early, and I hope that leads to earlier diagnosis of both Crohn's disease and ulcerative colitis, and that does have benefits. Plus, I think it's important that patients are honest with their doctors in describing the impact of these conditions. Important that your physician and your nurses understand the physical symptoms that you're experiencing. But also, I think it's very important that patients are honest with their healthcare providers about the psychological impact of their symptoms and their disease and the social impact of what they're going through. And I think physicians can help with all of these domains. I think our patients with inflammatory bowel disease need a very holistic approach, and really that early diagnosis, that early communication with healthcare providers, that honest communication can have big downstream benefit.
Dr. Marshall's message to patients concerned with the symptoms of Crohn's and colitis? See your doctor.
Really, the ultimate goal is to give them normal quality and quantity of life and get them in a condition where they can enjoy all the normal life experiences that you and I can enjoy. We certainly know that the earlier patients are treated, the better. Remember, Crohn's disease and ulcerative colitis are both chronic, progressive illnesses. Very important patients talk to their physicians. Now, I'd emphasize again that these are young people and that this early investment in treatment when we find disease can have benefits. Most of our patients in the current age with the treatments we have available can achieve those goals and do well.
Canadians who are concerned with the symptoms of Crohn's disease or ulcerative colitis should speak with their healthcare professional regarding treatment options or visit the websites below, crohnsquiz.ca and colitisquiz.ca.